Hello, I'm Dr. Brian Krasnick, Child Psychiatry Fellow at Wayne State University, and today I'll present our Quality Improvement Project, Enhancing Social Work Interns Proficiency in Psychiatric Rating Scales for Improved Patient Care. I'd like to thank my faculty mentor, Dr. Tamina Shakir, for her guidance on this project. Psychiatric rating scales, such as the Beck Depression Inventory, Vanderbilt Assessment, and SCARED Questionnaire, are important tools in psychiatric care, guiding treatment decisions and monitoring progress. However, social work interns at our office typically begin their rotation without structured training in these tools, resulting in limited confidence in clinical effectiveness. Our primary goal was to improve interns' familiarity and confidence with psychiatric scales, ultimately enhancing patient outcomes. Before initiating this project, I discussed its value and feasibility with our clinic social work supervisor, who agreed it would be beneficial. I then conducted an intake questionnaire in October 2024 to evaluate interns' baseline familiarity, confidence, and anticipated barriers. In the days afterward, I delivered a 45-minute workshop focused on hands-on practice, case-based discussions, and interactive role-play exercises. We employed the Plan, Do, Study, Act cycle, PDSA cycle, allowing us to iteratively refine the training based on ongoing feedback. Data collection was performed using structured surveys. Initially, in October 2024, interns provided baseline data regarding their knowledge, confidence, and perceived barriers. After training interventions, we conducted follow-up surveys in January 2025 to quantify changes in interns' knowledge, confidence, perceived clinical impact, and continued challenges. Using feedback from this second survey, we held a follow-up workshop in February 2025 and began to redesign our clinic's resource wall to improve accessibility to scales. Graph 1, Baseline Knowledge, Intake, October 2024. Initially, interns had limited familiarity with psychiatric scales. 0 interns were very familiar, 4 interns were, quote, somewhat familiar, and 1 intern reported being, quote, not familiar. In Graph 2, confidence levels, pre versus post, you can see that confidence significantly improved from intake to follow-up, shifting from uniformly, quote unquote, somewhat confident to a more positive distribution that included, quote, very confident. In the bottom left graph, Graph 3, knowledge improvement, January 2025, following training, all interns reported improved knowledge, with half indicating, quote, significantly improved. Graph 4, perceived clinical impact, January 2025. Importantly, 1 intern found scales, quote, somewhat improved their clinical work, and 3 out of 4 found it, quote, significantly enhanced their clinical work. Interns also provided valuable qualitative feedback. Common post-training barriers included patient apprehension, practical difficulties accessing scales quickly, and time constraints during sessions. Despite these barriers, interns emphasized the value and helpfulness of the scales, stating, for example, quote, very easy to implement and very helpful, and highlighting the importance of easy accessibility. This feedback was instrumental in directing further improvements. In response to intern feedback gathered in January, we held our second formal workshop in early February, focusing on practical concerns such as patient apprehension and the efficient use of scales. Additionally, throughout the rotation, I regularly provided informal, personalized guidance as needed. To address practical concerns around accessing scales, we are in the process of redesigning the clinic's resource wall, grouping resources by a diagnosis, thereby enhancing workflow and accessibility. The 2 structured training workshops, complemented by intermittent informal guidance, improved interns' proficiency with psychiatric rating scales. Interns reported increased confidence and found these scales beneficial in clinical care. We acknowledge potential limitations, including our small sample size and reliance on self-report questionnaires. For sustainability, we plan to continue monitoring outcomes, conduct further PDSA cycles, and provide ongoing informal support and discussions. In conclusion, our combination of formal educational workshops and ongoing informal support enhance social work interns' proficiency with psychiatric rating scales, benefiting patient care directly. Practical accessibility adjustments and continuous iterative support were critical factors in our project's success. I want to thank Dr. Tamina Shakir for her mentorship, social work supervisor Jennifer Gavrila for her collaboration, and our social work interns for their active engagement. I'm also grateful to the Detroit Medical Center QuESST program for this opportunity. Thank you very much for your attention, and please reach out with any questions.